Welcome back. Daily medications are a fact of life for millions of Americans, but even something as innocent as an aspirin could come with some side effects. Dr. Timothy Quinn, who practices family medicine in Richland, joins us now live in the studio to talk to us about those unintended consequences. Dr. Quinn, what are some of the most common things to watch out for?
Well, I mean, the bottom line is side effects. I mean, you can have the cough, the rash, the stomach pain. But a good example is a patient I saw a few weeks ago. She came in and her blood pressure was elevated, and she revealed that she had been on blood pressure medicine in the past, but she stopped taking it. Yeah. Well, I convinced her, let's go ahead and take medication. We did lab work and we prescribed the medicine. She came back a week later and the blood pressure was still severely elevated. Well, she told me she went to the pharmacy and she got the packet insert, and it had the side effect listings, and she read them, and then she went and called her favorite doctor, Dr. Google.
Okay.
And you know, she read more and she learned that the medicine had other potential side effects, so she did not take the medication. But that was not the route to go.
Yeah, just take the blood pressure medicine. What are some of the common side effects? We have nausea, we have drowsiness, itchiness, rash, things like that.
I mean, there are a lot of different side effects, but what I explained to my patient was the FDA, which is our governing board for the United States, they make the pharmaceutical companies go through very lengthy different research, just safety protocols. I mean, first you have to start out with animals, and if it's safe with animals, then you can do the testing on humans. But by the time the medication is approved, it's been proven safe and very effective. I mean, all medicine can have side effects like over-the-counter, but the take-home is you just have to communicate with the doctor, and the doctor has a responsibility to communicate with the patient to let them know what to look for. And if the medicine does have side effects, then the doctor can try a different class of the medications.
What if you're on more than one medication? We hear sometimes that people might have overdosed, but they just had therapeutic levels of multiple drugs in their system at the same time.
Well, that's where the communication comes in, because as medical providers, we are educated on different cross-reactivities of medications. But basically, like I had a patient, I told her that the medicine could cause cough. She had a little cough, and she told me about the cough. So I simply changed her from the class of ACE inhibitors to the angiotensin receptor blockers, and her cough was relieved. But the most important was she didn't just stop the medicine, and her blood pressure was still controlled.
That is good. A lot of people drink when they have medicine too. You always see with antibiotics, it's just steer away from a beer and a liquor. What are the effects those can have on the medications that a person takes?
Well, it just depends on the medicine, but once again, I go back to the communication. It's just so important that you communicate with the doctor, you know, about the medicine and ask those questions, because each medicine has different side effect profiles and cross-reactivities, but the communication allows the doctor to be specific to that medication and make sure that you're safe. And if you do drink, always moderation, even if the medicine is not, you know, contraindicated with drinking.
You got to use some common sense out there with that.
You have to. And like the patient that didn't want to take the medicine, I explained to her the side effect of not taking the medicine is very probable, and it could be a heart attack or a stroke, and it could have taken her life.
You always see these commercials for these new medicines that are on the market. At the very end, a guy starts talking really fast about these possible side effects out there. Is something always keep in the back of your mind? Or?
Oh, yeah. I mean, it's very important, like I said, to have that information. And like I said, as a physician, I have to explain about side effects so patients know what to look for. But at the same time, just know that we'll explain what are the severe side effects when it's an emergency where you need to really seek attention, such as chest pain or difficulty breathing. But the most important thing is to educate yourself, be aware, and communicate with your medical provider so that the information can be very clear and you can be safe.
That's it. Thank you so much for that, Dr. Quinn. Thanks for stopping by today. Quinn Family Medicine up